In this lecture, entitled Pituitary Tumour Masquerading as Presbyopia, I'm going to present a clinical case, the results of which really made me think about the way I deliver my clinical service. So let's present the case. This gentleman was a 45-year-old male whose presenting complaint was that he was having increasing difficulty with his vision for around about 3 to 4 months. In particular, he was struggling to read more than his distance vision. Over that last 3 to 4 month period, he'd consulted 2 separate optometrists and had not been happy with either of them. They'd both given him a diagnosis of presbyopia, explained what presbyopia was, and had given him new glasses for reading. But when he saw me, his vision was still not right, and particularly he was struggling to read with his left eye, and it was affecting his ability to read pages, particularly when he scanned over to the left-hand side to start a page. One of the first things I did before I saw the patient was actually chase up his previous optometry reports. So if we go back a year before he presented, all of his previous optometry reports were normal, and he'd always been able to see 6/6 plus in both eyes independently, with N5 independent reading vision in both eyes. Previous optometry reports had described normal pressures and normal discs, but at the most recent report, where he was diagnosed with presbyopia, I've shown the numbers. So his right eye was 6/6 and N6, with a -3 sphere and a -150 sill, and his left eye was -4.25 sphere with a -1 sill. But the key here is that even with optimum correction, with correct spectacles, he only achieved 6/9 -2 and N8 in the left eye, and it was impossible to get him seeing any more clearly than that.
If you enjoyed this lecture so far, please subscribe to http://iop.vision. I hope you enjoyed this series as much as we have putting it together. Thank you.